Welcome to another episode of the Bravo Zulu live stream series. I'm Robin Blanford. I'm the Chief Executive at D4H. And each week I talk to one of our customers about how they're using D4H to manage their incident responses. And this week, we're very lucky. We've got the New Jersey EMS Task Force. On the New Jersey EMS Task Force, we're going to speak to Bucky and Nick. Bucky is the state planner, and Nick is the planning specialist for the vaccine delivery program. And what we're going to do is go through how they use D4H for their vaccine delivery program, talk about an EMS task force. They've delivered over 500,000 vaccine doses since it began, and they're going to talk through how they coordinated that across all the different venues. So delighted to bring the guys in. Here's Bucky and Nick. Hey, guys.
How are you? Thank you for having us, Robin.
No, delighted to have you. Thanks for joining. Let's get kicked off with just what you do in your roles. So, Bucky, you are the state planner. What's that involve?
Correct. So I'm one of 5 state planners with the task force, and we do daily activities for the task force, which includes scheduling of special events, working on plans specific to the EMS response to multitude of different activities, pre-planned, man-made, or weather related, and supporting the equipment and the agencies that make up the task force.
Excellent. And Nick, you're planning specialist?
Yes, sir. Planning specialist with the task force. I was brought in to assist with the vaccine transfer program. I do a lot of the coordination and the planning behind the transfers themselves, and helping the crews figure out where they're going, where they're picking up from, and how that project really runs.
Excellent. So you're the right guy to talk to today. So you can join this conversation. We're going out live over YouTube, over LinkedIn, over Facebook, over Twitter. So wherever you're watching the stream, if you just reply underneath the stream in the comments section, you'll be able to reach us live and send your questions on. If there's anything you see today that you like the look of, you think, I've got an interesting question on that, the guys will answer you live on air. So first thing we're going to do is we're going to jump to where in the world this is. So New Jersey, for those who maybe are or aren't familiar, let's have a look on the map. Obviously, we're around in the US again, and you can see in the northeast corner here of the US. Guys, talk us through the kind of terrain and what you've got there. What are the kind of notable bits about New Jersey? A lot of Atlantic Ocean facing property.
Absolutely, a peninsula, that sits off between basically New York and Philadelphia as our 2 major metropolitan areas. To the northeast is mainly an urban setting, where you get out a little more west, it's more of a suburban setting. Atlantic City down in the southern area, and then, outside of Philadelphia and New York are the most populated. But we have some beautiful areas of New Jersey, including the Pine Barrens and the Skylands and others. And then we're known for our Jersey Shore. Don't believe the Jersey Shore, the MTV show series, they should have stuck with, playing music videos 15 years ago. But yeah, that's the Jersey Shore, and that brings its own challenges and activities that we've had, especially like Hurricane Sandy and prior.
So is the Jersey Shore what we're looking at there? That's it?
Yeah, from Cape May, which is the bottom portion there, all the way up to Sandy Hook. And that is the Jersey Shore. About halfway in the middle, there's probably the looks like Atlantic City, about halfway there, and that's the big gambling area. But the beautiful part of the shore is the whole shoreline, and that's a big part of New Jersey. We're known as the Garden State. It's not just the urban setting, so it's a little bit of everything.
So the New Jersey EMS Task Force, what is an EMS Task Force?
Sure. The New Jersey EMS Task Force, we were formed in after the events of September 11th, when a lot of resources were requested into New York City and to the northern shorelines where people were evacuating. And we had hundreds of ambulances that were going to those locations to assist, along with everybody else who was trying to assist. Out of that came the need for cooperation, collaboration, and coordination of all these assets. And the birth child of the EMS Task Force came on a napkin by some of our founders, sitting at a bar and coming up with what can we do to solve this problem and be better prepared to respond in the future. And that was the birth of the EMS Task Force. We started in 2004, became active with our first meetings in 2006, and have served the state of New Jersey and other areas, including Louisiana, the state of Louisiana, as well as the U.S. Virgin Islands over those years.
Excellent. So what does an EMS task force do?
Sure. So we help in managing and or assisting with large scale incidents. Again, whether it be man-made, such as an explosive event or some sort of gas release, what have you, to the everyday natural hazards of flooding, fire, hurricanes, tornadoes. And we're there to assist the local providers with cooperation, coordination, and response to those type of events. So we'll come in and help with the planning portion, the staffing. We'll bring some specialized resources. You see up here on the screen now is one of what we call our medical ambulance buses, or MABs. And this was early on in the COVID stage, where we were evacuating a nursing home. And we used 6 of these mobile ambulance buses to move multiple patients in one swoop. Basically, instead of tying up 20 ambulances, we use one bus to do that. So we're able to, bring in the logistics, communications, all the different tools that will assist in that response.
Sorry, maybe you couldn't hear me there. How many patients can you carry in one of these?
Sure. No, I did not hear you. Sorry about that.
No problem.
Yeah. So the buses vary a little bit. The one you're looking at, I believe, is a 20-passenger, mostly wheelchair. It has the wheelchair lift there. We do have ones that will carry up to 24 patients. There's an example of one, and that loads from the rear and gives us the ability to have 3 stacks of patients along the sides of that, on both sides. And it allows us to have attendants that will assist those patients during transport.
So there's 3 stacks of trolleys, or not trolleys, but stretchers, effectively?
Stretchers, yes. So,
24 on stretchers, is that what you're saying?
Correct.
Wow.
Yeah.
So a huge number of people.
Yes. And so these are force multipliers. These are the ones that, instead of bringing in 24 different ambulances, we can show up with one of these and move that group of people to either a single location or, make multiple drop-offs. They came in very handy during Hurricane Sandy, when we had to do immediate evacuations of hospitals in the northern section as floodwaters were coming up. And you can pull up with this and assist. We also use these for fire scene rehabs. They come in great. You basically sit up the stretchers, and the firefighters can go in there and get a break from the elements.
So yeah, the air conditioning on welfare.
Correct.
Excellent. What's going on here?
So this is a one of a kind, and the only one we've done so far. This is the New Jersey EMS Task Force answering an EMAC, or an Emergency Management Assistance Compact request to the U.S. Virgin Islands, specifically to the islands of St. Thomas and St. John. This was following Hurricanes Maria and Irma, which devastated the Virgin Islands. And we were asked to come down with specialized equipment and personnel to help rebuild basically their EMS system on the islands. So we brought, this is one of the Air Force's units that flew us down there with all
Mhm.
of our equipment on it. I believe there were a total of 3 flights that brought our vehicles, our tents, our personnel. We also had the New Jersey State Police, one of our partners, that brought a security team with us, and we did three deployments down to the Virgin Islands as the task force, and spent 8 or 9 weeks in total assisting in the response of the local agency. So we were staffing ambulances, but we were also helping in planning the rebuild and things along those lines.
Wow. How many people are on the task force?
So our task force is made up of approximately 225 personnel in total, all of which are volunteers with the exception of the planners who are full-time employees. We are covered under grant funding through our Department of Health, who we work very closely with, and allows us to be able to prepare for all these type of things. One of the things is the pandemic, obviously, and what you see here is some of our tent systems that are carried on a flatbed truck. They can go to a community that's experiencing a surge in COVID outbreaks or anything where we need to have a drive-through type system. And that's exactly what this trailer is set up for, is to set up drive-through, whether it be testing, vaccination, or distribution, a point of distribution type of system. So,
excellent. Who are the task force talking about 200 plus members?
So
where do they come from? How is it formed?
Sure. The task force membership comes from what we call host agencies. So there are EMS agencies from across the state, volunteer departments that respond to 911 calls, hospital systems, regional EMS providers, and they become our host agencies. So they actually hold the equipment and have the equipment that we've supplied to them, but they also supply the personnel. All of which are volunteer unless we have a reimbursable type of event. And they're sponsored by those agencies working underneath the task force. Myself and Nick are both employed by a local agency, South Branch Emergency Services, and we are assigned to the task force as part of this response through those grant fundings.
Excellent. How often are people training? I mean, I assume they've got their professionals already in their job. But I mean, how often do they have to come together as a task force?
Yeah. So one of the things that we bring is that specialized training. So, whether it be attending conferences, whether it be training programs that we're doing here at headquarters or at local host agencies, we do a lot of incident management training, specialized training. We send people out to FEMA type programs, bomb recognition and blast injuries, things along those lines. But we have, from physicians down to your field EMTs that are part of the task force. And usually once a month, we're out doing something. We have one annual big, get together weekend, and it's an exercise weekend where everybody comes in. We have a mission for, a simulated mission for the weekend. And we set that up, and that's coming up this October for us.
Okay. Very good. Where will that be? It's obviously within the state, and everyone gathers.
It will. Yes, it will be in the state. We're not sure yet where. We just started the planning for it. We've done it on Joint Base, which is the McGuire Air Force Base and Earl, and there's the three. It's 3 bases put together. We've done it there. We've had events at other locations as well.
Okay. And how'd you get activated? Is that through a mutual kind of agreements with agencies, or who can activate you?
Yeah, so we're activated specifically through the county offices of emergency management. So all events start and end locally, and here in New Jersey, that holds very true. However, the counties help coordinate and help the cooperation to support those local agencies. So if a local agency has a request, they will contact their county OEM EMS coordinator, who will then request our services. We have an incident advance team. That incident advance team will make contact with the county or the requesting agency and find out what is needed. And then we can deploy individual modules. We're made up of specialized modules such as communications, staging, medical operations, HazTech, planning, to name some of them. And we can deploy part of those mods, or we can have a full team deployment to an event, depending on what it is.
Excellent. So one of the big pieces I know we sort of worked with you on, or possibly was the reason you started with D4H, was the vaccine delivery program. I think it's Nick's specialty, but you sent over a sort of flow chart. I guess it's worth me bringing that up.
Sure. So yeah, we in the past we have relied on a multitude of different programs. Most of them open source, Google Documents and the like, to be able to manage some of our events. We saw COVID coming along. We had a response starting at the outbreak, which was March of 2 years ago now. And we found that we had to have some sort of management system to track the equipment that we were getting in, track the different requests that we had, and basically keeping a situational awareness for everybody. So on the screen here, you see some of kind of where we started. And the first request we had was a hospital surge tent, where a hospital requested a specialized tent to be set up outside their ER to assist with the incoming surge of patients. And that really started the ball rolling. Shortly after that, we had testing sites that were being set up, and we were asked to support the logistical needs of 3 of the federal testing sites. Then we had the National Ambulance contract, which is a FEMA contract that brings in, I think we had 150 or so ambulances brought into the region from outside of the state to assist us in answering 911 calls, because our providers in the field were just overwhelmed and needed that help. So we assisted with that, with the planning, the distribution of those units, and tracking, as well as the reporting of that back to the Department of Health for them. And go ahead.
No, so I was going to ask you, I mean, what was the most challenging part of all of this, of a vaccine delivery program?
Yeah, for the vaccine delivery program, it was just making sure that we had good tracking. This is controlled by the CDC. We had to have good paperwork to back that up, and the planning that goes into it each day. Like every single day, we're getting requests for where the vaccine needs to be delivered to. Again, at this point, we were not putting up we were not putting shots in the arm. We had done that in partnership with the Visiting Nurse Association of Central Jersey. We had done, multiple sites where we were assisting with EMTs and paramedics and nurses. However, at some point we needed to start tracking exactly what we were doing. And that's when we started looking for that management software to be able to help us do that.
It's great that you've sent these photos on, because it really gives people a feel of what it was like for you. And is this command truck we're looking at?
This is what we call our emergency or EMS command center. And this is basically where we set up to do office work. This is early on in COVID, when the National Ambulance contract came into the Meadowlands. And you see that most of our work is being done on whiteboards behind us, which can only be shared, obviously, in that space. And we're using open source FEMA situational awareness tools at that time to manage. And this was right as I think we started talking with you folks about the opportunity. Yep.
And this is sort of early days then.
And that's 9 months later, when all of a sudden the vaccine was out, and they were starting to close down what we call the mega sites, or the large areas where people would go to for vaccinations, and distributing the vaccine to other locations. So I'm going to kind of turn it over to Nick, because we brought him on board to manage it. And, thank gosh, because, there was so much involved in that. So
Sure. So just like Bucky said, the Department of Health reached out to us when the mega sites started to demobilize and scale down. And they had all this surplus of vaccine that needed to be distributed across the state, which included anything between local doctor's office and pharmacies and other smaller public health departments. So a little bit of background with the program is that the Department of Health each week puts out a feeler to these provider sites that might want vaccine. And they send out their survey, they get the feedback, they collate and coordinate all their information into this Excel spreadsheet, and then they send it to us. Our responsibility is to determine how many crews are needed for the week, where we're picking up from vaccine-wise, and where we're going. And this all needs to be done within 12 hours. Vaccine has a window of transport. So with that in mind, we need to plan and coordinate and optimize routes accordingly to make sure we maintain our threshold below that transport time. So we receive that spreadsheet, we do our planning, and then we solicit participation from the host agencies, like Bucky said, to see who would be able to provide us a crew. We had implemented a training program from the beginning, with handling of vaccine, storage of vaccine, transfer of vaccine, the coolers, paperwork, and just documenting all the necessary information that goes into these transfers. So every day, or almost every day, we take the Excel spreadsheet, we do our breakdowns, and then we go and we put, or as you can see, yeah, those are the coolers we use. Everything's very temperature controlled with digital data loggers and everything like that. So we then, in D4H actually, we create an incident action plan. It just outlines, personnel, equipment, and what's to be expected for the day. Where are you going with the vaccine, all your stops, things like that. I don't know if you want to pull up the IAP.
Yeah, so I can switch that on. I think that's your screen there. Here we go.
Yep. So this is a monthly IAP that we come up with. That basically is your traditional IAP. It covers 1 month period because we're pretty much static in what we're doing. However, every day there's new crews. So we're kind of using both sides of D4H. We use incident management for the overall overreaching stuff, and I'll show you, or Nick will show you here how we use the incident management for tracking of our vaccines. But we also use the personnel side, which does our scheduling and number of hours and our time, our time requirements and all that, shows what vehicles are being used each day. So instead of actually doing a full IAP each day, we're kind of using it as a 201 briefing for each crew for each day. So this is our, the IAP. Let me just scroll through here. We've got the traditional, your 201 with your briefing and your actions and strategies. The 204 is basically what we do each day, depending on, what is needed. We have the different agencies that will report out. Medical plan for this one's a little different because we're all over the state. So it's basically call 911 and let us know what's happening. But that's the gist. And one of the great
everything we're seeing here is out of D4H, right? This is the printed form.
This is the D4H program. And it's the nice part about it is once you enter the information, it comes across all these different platforms. So if I assign, for instance, Nick is the planning specialist here. He shows right up on the org chart as the planning specialist under planning. And he's the guy. He should really be in this top box. But it shows that, the Department of Health is the one that runs all this, and they are the one that we basically are in partnership with. And it's that important partnership. And then we included 214, and the great thing about the D4H 214 that we've learned to love is that we were able to customize this just for our use. And some of the things that we did, which was very important to us, was to include, our start and end times, so we could have an easily figure out how many hours, but also our mileages, because each one of these vans is getting reimbursed on the number of miles that they do. So we were able to get one form that was able to capture the important management data that we needed each day.
Do you find customizing it easy enough? Is it easy enough to do?
We had these up and running, like I said, we had talked for quite a while before we were able to obtain the funding. We're a nonprofit organization, so funding is always the key part. And luckily through funding, grant funding from the Department of Health, we were able to support some of these things. But it was a matter of going in. We made little tweaks along the way, but so easy of going into the admin side. And even I could do it. So that means it's pretty darn easy. So yeah.
So you said you might be able to pull up a couple of other reports and
sure.
screen.
So this is you want to talk about this?
So this is the D4H Live. So with each associated pickup and transfer of vaccine to the location, we associate a transfer number to it. And as you can see on the top, it's date, receiving facility, doses dropped off. One of the large things is the status. This is how we can track, or I can track during the day, how each crew is progressing throughout the day, and I can see where they are within their daily runs. You can see type of vaccine that's being transferred, which site's receiving how many doses, where it's coming from, the lot numbers, the expiration, and the units reporting. So all this data is you can manipulate it, and then once it's locked, everything's set. But we also receive our information from the receiving facility about what time. So if a facility has a question about if they receive vaccine and who received it, we can provide that readily.
Yeah, this one's obviously a made up one because we delivered it the same time we picked it up. But it's got all the data that we need to be able to provide to whether it be the pharmacy that's receiving it, or to the Department of Health, or to the CDC who may request. And that gets down to the temperature that it was delivered in, who delivered it, who received it, and we went through a couple of different revisions of this along the way. One of the things we've asked for, and that I know that D4H is working on, is multiple signatures of locking sections versus a floor. But what we did is we implemented a quality review process that no chart is locked or no delivery is completed until somebody with myself, Nick, or one of the other planning specialists actually looks over and makes sure that everything's okay. There were no excursions from the temperature requirements, and that everything's good. So that's been a godsend from a standpoint of keeping an eye and being able to provide the documentation that's needed. And the other thing is the Department of Health, our vaccine delivery program that gives us these orders, is able to watch this as well in their command center. They log right in each day and they'll see, hey, something wasn't done today, and ask a question. So
what are you entering that data on? Is it laptops or tablets or what?
So each. Go ahead.
I was looking at that signature, thinking it looks like it's done on an iPad or something.
I put this in on the laptop, and I
using the default.
The crews obtain signatures and information via cell phone through the
app.
Oh
wow, great.
Yeah.
Well, what I love about this is we don't actually have a vaccine transfer feature. It's you guys have built it on the status boards. It's great.
And that's exactly it. We found that the status board could be customized to meet the need. And as we go back, one of the things that we need to keep an eye on is how many doses have we delivered. We start a new one each month, and that is basically for the status board, so the status board doesn't get too huge. So we start a new one, and this gives us how many locations we've delivered to, and how many doses right off, and how many people did it, and it's right off of this home screen. So again, one of the benefits of that.
Do you have anything on the map? Is there anything geotagged, or is it not?
There is not currently, and I'm sure later on we'll talk about that. This is the headquarters where we start and end the day. This is the state of New Jersey's Department of Health lab, public health lab, and that is where we're based out of for this. So all of our host agencies report there, meet with Nick in the morning. They're up at dark 30, starting the vaccination, the pickups of the refrigerators. They go off to one of the large centers. As of right now, that's really the only mapping feature that we're doing.
Yeah.
We also have the ability to put, if you go into receiving facility, you can put in all the sites that are receiving for that week or that month. You can put in address, physical address, point of contact, phone numbers, and the name.
Yeah.
So
I noticed the title of the channel is April 2022. Do you start a new channel each month? Is that what you're doing?
Yeah. So each month, one of the things we started this. When did we start? May of 2021. We started this vaccine. 48th week. It was going to be a 12-week project, and it's we're 48. But again, we were all going to be in quarantine for 2 weeks, and all better. So, but we started it in May of last year. I think we ran till September or October, and the vaccine transfers just got overwhelming to try to manage that big of a list and have it load each time is one.
Absolutely.
It wasn't built for this, but it worked. Our workaround turned out to be we can do a whole month, which it has hundreds of deliveries for that month, and that works fine. It works fine on most people's semi-intelligent handheld devices. So
excellent. So I always ask people on this, what would you like D4H to do? And you've already mentioned there, or like, what would you change? What should we work on? And I always like doing it live because I've kind of got to think of the response. But you mentioned double signatures. So just to talk through that for people, I think it's a great idea. It's when there's a form, there might be multiple sign-offs. So if the signature is in a block, I think, did we say the block would be signed, or we said everything above the block would be signed?
Right. So, and that obviously is up for discussion. What we were doing is we were originally getting signatures of the receiving facility of the center. The problem was we couldn't go back into the form and then make corrections, additions, change the statuses. Like, we don't change it to complete until we've reviewed the actual chart at this point. So by them signing it, it locked that chart. So that's when we changed it to just getting their name, title, and phone number. And then the actual QA person is the one signing it. We'd love to see the sections be able to lock that section. So for instance, if the receiver were to sign this, it would lock that section only, but still allow us to manipulate the data if need be for whatever the reason. In other sections, or even above the line, and we can work our way down the line. So that's one of the enhancement requests that we've made. Up to you folks.
Yeah. There was just a little bug earlier on too, where the transfer incident itself was locked, and I had to go in the system and unlock it for a crew, they'd lose a signature.
Say that one again.
So if we unlocked it to make a correction, like they put the wrong DDL, which is our temperature,
you lose all of the signatures.
It would lose all the signatures if we unlocked.
Yeah, so that wasn't a bug. That was on purpose because somebody signed it and said it was correct. So at the moment we allow multiple signatures, but we don't allow multiple. You can't edit any of the rest of the form. Only add more signatures or remove them all. But I think the block signature piece we're talking about there would solve that. What you'd end up with is it would only be that block would clear of signatures, not the whole form.
So that's one of the things. And then we mentioned before, you brought up the GPS integration, and some way for us to integrate with whatever type of tracking system that we may have, for, whether it be an Esri or I'm not the tech guy, okay, I'm a planner, but something that would allow us to physically track through whatever that method is, units, equipment, so we can see if it's moving. The incidence is great on the map. If we have multiple incidents going on and we've opened them, we can see those all on the actual map itself. But we can't necessarily track anything live when it's moving. And that I think would be very helpful for us, especially at large scale events. I think of events at the Meadowlands or some of our big beach parties that are coming up along the shoreline. To know where your staff are physically, if they're wearing a smart device of some sort, would be.
Are you able to click on map there if there's not confidential information? There's only the one pin.
Yeah,
that's great. Yeah, so our plan here is that anyone using the mobile app, their position will show. So there'll be a share button, share my location on the mobile app. You'll be able to press that, and from that point on, for say an hour or whatever they choose, share their live location. It will show them on the map as a pin. So that's our plan there.
That would be a great enhancement.
Yeah. The next step of that is to allow location to come through from other. So at the same time, possibly let's call it fleet location. So overlaying third-party, fleet management systems, whether it's aviation or vehicles, ground GPS, depending what it is, that we can overlay that. But you wouldn't be able to such interact with it other than just click it. Versus the difference with a live person through the app is we know that's actually the person in the software. So we can associate it through the tasks they've done, what they've done, the log. It's a very different piece. So that is our hope there for sure.
Excellent.
Anything else you'd like to show here, or we've covered the vaccine, which is great, the vaccine delivery, which is great. It's very useful for other people to see it, and I hope people get value out of seeing how you've configured forms.
Yeah. And other than that, this is kind of what we've been doing over the past, 18, 20 months. Now with the vaccines, and the one is the bar of how many vaccines we're actually delivering week to week. Again, we're providing a conduit between the place that has expiring vaccination and a place that needs vaccination to put in arms. It has nothing to do with, the actual delivery in this program of the vaccine itself into an arm, other than getting it safely from point A to point B and having the necessary tracking so we don't waste what precious vaccine we do have.
Have you had other deployments while this was going on? Have you had multiple at the same time?
Yeah, so it's now starting to happen. We had, during this event, we had the hospital surge, which was over the holidays this past year, where, we had to have teams deploying out to different hospital systems to help build out and or staff surge tents outside the hospitals. And that was, again, in partnership with the Department of Health and our New Jersey, the State Police's All Hazards Incident Management Team. And we were able to come together and help them manage the needs that we could provide. But then, other things continue. We had a flood in the middle of this, a huge flooding event where we had to respond with several MABs, the medical ambulance buses, and evacuate two nursing homes that were going underwater. We've had utility disruptions along the way, and that's continues to be a response for us. We've had some major multi-alarm fires that some of our local agencies with the equipment that we supplied have been able to go out to. So it doesn't stop because of COVID, and it doesn't stop because the vaccine delivery is going on. We are an all hazards team. We are specialized in EMS, but we're there to be able to help however and whenever we can. And that's, again, inside and outside of the state.
Excellent. That's been fantastic. Thank you for showing that to everyone. Again, as I said, people do find it very, very valuable to see how other people are using D4H, and especially when you can share the screen on a live broadcast like this, people just get an insight into how easy you found it to use. So that's fantastic. Thank you very much, both of you. I don't know if there's any other comments you have. Otherwise, we'll start to wrap this up.
Very well. No, again, we appreciate the support of your team in helping us meet our mission, and that's really what that this has all been about. And we appreciate the support you guys have shown.
No, excellent. Thank you very much, guys, and look forward to talking to you again soon.
All righty. Thank you, Robin.
Take care.
Bye-bye.